Great. Thank you, Governor, and good afternoon. So a couple of updates in the numbers update and then some comments about some new quarantine updated recommendations that we have. So in terms of the numbers, we are announcing 706 new people diagnosed with COVID-19 today. 518 of these people tested positive by PCR and 188 tested positive with antigen testing. In the last week, we continue to average about 750 to 800 new infections per day statewide. This number has been stable for the last several weeks. And currently statewide, there are 6,728 people with active infection. Our test positivity rate is averaging about 7.7% over the last week. This is down from 8.7% last week, so that's some good news. And then statewide, there are currently 270 people hospitalized with COVID-19 across our state. This number is also down, now below 300 for the last 2 or 3 days. Sadly, there are 12 new people we are announcing that have died from COVID-19, bringing the total to 897 total people that have died from COVID-19 during this pandemic. 9 out of those 12 individuals are people associated with long-term care facilities. And in the last week, there have been a total of 70 people that have died from COVID-19 in our state. So we're averaging about 10 people per day dying from COVID-19. In terms of some updated guidance we did release a Health Alert Network message earlier this week to our healthcare providers and public health partners, making the announcement that we are no longer recommending or requiring quarantine after an exposure or travel-related risk factor for people who are fully vaccinated against COVID-19. Now, full vaccination means that someone has received 2 doses of one of the currently available COVID-19 vaccines and is 14 days beyond their second dose. So these individuals who are fully vaccinated are no longer required to quarantine after a close contact exposure or travel-related risk factor. Similarly, we are no longer recommending or requiring quarantine for people who have previously been diagnosed with COVID-19 either through PCR or antigen-based testing in the prior 90 days. Now, this does not apply to people who are clinically diagnosed based on symptoms alone. It does not apply to people who might have had an antibody test looking for antibodies, because antibody testing does not give an indication for when somebody might have been infected. But for somebody that is diagnosed by antigen or PCR-based test with COVID-19 in the prior 90 days, those individuals also are no longer required to quarantine after an exposure or travel-related risk factor. Now, this is not a free pass to travel, nor is it a free pass to relax restrictions, and we continue to recommend against any non-essential travel. In fact, the CDC is currently, or this week, released some additional guidance for international travel, given some of the new circulating variants or strains of the virus that are being seen globally. So there continue to be recommendations around restricting non-essential travel. And people need to continue to follow all the other mitigation guidance, including avoiding social and group gatherings, practicing social distancing, wearing face masks whenever people are out of the home and in public places, and continuing with all the other layers of protection we have recommended. All of this guidance continues to apply to people who might be fully vaccinated or previously infected. Now, the reason for this is because we know that no vaccine is 100%. We're still learning about how long protection lasts after somebody is vaccinated. In fact, vaccine studies are currently being undertaken to try and quantify how effective vaccines are at preventing asymptomatic spread or transmission. And as I mentioned, there are new variants or strains of concern that are circulating globally. And so while we relax the quarantine requirements for certain individuals who are fully vaccinated or previously infected, we continue to need to take a multi-layered approach to preventing spread of COVID-19 and still emphasizing the need for people to avoid non-essential travel, avoid the social and group gatherings, practice social distancing, and wear face masks whenever out of the home and in public places. We're still very much in the midst of this pandemic and need to do everything we can to stop and control spread of this virus. And with that, I will hand things over to the Commissioner. Thanks.
Good afternoon. I'm going to do the vaccine update first and then follow that with our long-term care outbreak update. So to date, 86,275 first doses of vaccine have been distributed in New Hampshire, and 53,432 people have received their first doses of the COVID-19 vaccine. An additional 4,751 people have received their second dose of vaccine. This week, we received an additional 17,175 doses of vaccine, which will be used to continue vaccinating our highest-risk healthcare workers, our first responders, and our long-term care facility residents and staff. We expect to receive a similar amount of vaccine next week. More than 30,000 people have registered to receive vaccine at our state-run fixed vaccination sites, and about 15,000 people have been vaccinated at those sites to date. These sites are currently open to high-risk ambulatory care provider and first responders, and as we move into beyond Phase 1A, we will start to let the public know when they're eligible to go to those sites. Between CVS and Walgreens pharmacies, 96 long-term care facility clinics have been completed to date, and more than 12,000 people have been vaccinated through those programs. For long-term care outbreak update, we have 10 outbreaks to close today. Bedford Hills Center, Corville at Bedford, Carlisle Place, the Elm Center, Fairview Senior Living, Green Mountain Treatment Center, Hanover Hill, Lakes Region Community Services, Fairview Home, Mount Prospect Academy, Seacoast Treatment and Stabilization Center, residents at Salem Woods, and Ward Health Rehab and Nursing Center. So those are all closed effective today. 11 new outbreaks to announce: Birch Hill in Manchester, Carriage Hill Assisted Living, Dover Center for Health and Rehab, Greystone Farms, Keene Center, Kendall at Hanover, Lafayette Center, Langdon Place of Nashua, Meredith Bay Colony Club, St. Vincent's Rehab and Nursing, and Summerhill Assisted Living. That's all I have. Thank you.